Hi, everybody who's registered for this talk about MCAS with Deborah today. There's a few people coming in via the waiting room, so I'll just do my introduction while people are filtering in. A lot of people who have registered know me from Lyme Disease UK. I'm Julia Knight, who is the media, press, and community outreach manager, but I've been a bit in the background for a year or so after some disastrous surgery. So here I am back again, just putting my foot in the water with Deborah. A little bit about Deborah. Welcome to this meeting, Deborah, and thank you for sharing all your information and knowledge with us. Just so everybody knows, Deborah is, I'm going to read this because it's too long for me to remember. Deborah is Community Support Coordinator for Mast Cell Action and also runs her own business as a holistic health coach for people living with long-term illness. She joined the team at Mast Cell Action in November 24, and as part of this role is responsible for the managing a team of volunteers and creating resources for the MCAS community and healthcare professionals to provide people living with MCAS, with the tools that they need to support them on their health journey. She is passionate about raising awareness about both MCAS and Lyme disease, having experience of them both, and helping more people to get the help that they need. And I'm going to hand over to Deborah to introduce herself and her slides. And off we go. We're all really wanting to hear what you've got to say.
Oh, lovely. Thank you so much, Julia, and thank you very much for having me. It's lovely to be here. And thank you all for joining. I'm going to share my screen now. See if I can get my slides up. There we go. I hope that you can all see those.
Yeah, we can see them. I'm going to mute myself now, Deborah, as well. Just shout me if you want me to come back.
Lovely. Thank you, Julia. So, this is an introduction to mast cell activation syndrome. And as I say, I'm here on behalf of Mast Cell Action. Julia's introduced me very well, so I don't need to say any more, but just to note that I've put my email address there and I have got it on the final slide as well. So if you want to ask me any questions or get in touch, you can. So yes, I'm working for Mast Cell Action now, and I also run my own business, but I live with MCAS and Lyme disease and have been on the journey that many of you will have been on. And I'm going to share a little bit about that today as well. So my journey in 2017-18, I was working in woodlands all over the country, delivering events and engagement, living my best life inside ancient woodland and trees that you can see me there. And it was an amazing job and I loved it. And I remember in early 2018, I noticed a really huge bite on my leg. And I didn't think anything of it because I was working in woods and I was bitten all the time. But I do know that in February 2018, I missed my friend's 50th birthday party. I should have been going in fancy dress and I didn't get to go because I spent that weekend in bed with a flu, a fever, a cold. Again, just thought that it was a cold, didn't think anything of it. But by the end of March that year, I had become catastrophically ill, a complete myriad of mystery symptoms that I'm sure many of you will recognize: complete insomnia, racing heart, chest pain. A scan showed inflammation around my heart. The brain fog was absolutely crippling. Memory loss. I was twitching and jerking and had lots of muscle spasms. My hands and arms would go numb. I was having seizure-like events. I was covered in swollen lymph nodes, bruises, rashes. My eyesight was affected. I had a constant ringing in my ears. And basically, I lost my job because I was completely unable to function. I couldn't leave the house. So most of the time I was in my bed all the time. I certainly couldn't drive. I remember a friend sent me a jigsaw for an 8-year-old, just, something to do. And I stared at it, completely unable to put it together. That was a particular low point for me because I just couldn't understand what was happening to me. And after the first 8 months, I realized that a lot of my symptoms were being caused by histamine. That was the first clue, really, for me. I was reading as much as I could. Nobody could explain what had happened to me or what was wrong with me. And I realized that when I took antihistamines, I felt a lot better. So I realized that there was a connection there with histamine, and I did a lot of research and discovered mast cell activation syndrome. I eventually got to see an immunologist not without some difficulty, but I did manage to get to see an immunologist, and he began treating me for MCAS. And I improved quite a lot, but I couldn't get completely better. I was still struggling, and it took another 2 years to be diagnosed with Lyme disease, and I then began treating Lyme. And for me, treating the Lyme has improved my mast cell activation syndrome. So for me, I see these as two very interconnected conditions that I see in quite a lot of people in our community, and I certainly have experienced that. So what is mast cell activation syndrome? It's a disorder of the immune system. So it's when mast cells are activated by triggers such as food or chemicals in our environment. So our mast cells are part of our immune system, and they should respond to the things that are, an attack on us. But in mast cell activation syndrome, they become overactive and they react to things that shouldn't be triggering them. And you'll see, I'm going to go through the symptoms, wide-ranging symptoms. Some people are born with it. Some people suddenly develop it. Some people have it very mildly. And looking back, I can see I've always had it, but I was just, a bit itchy as a child, a bit intolerant to some foods. I was always the one that, we had to use washing powder that wasn't, very strong because I would react. I had to have, non-perfumed toiletries and things because I knew things made me itchy. But I had no idea that I had MCAS, but it was obviously just there very mildly. But then when I caught Lyme, it really kicked it off. And that happens for a lot of people, that they have it very mildly and don't even know they've got it sometimes. And then it can suddenly come on. And there is treatment for it, and I'm going to go into that, but it's a combination of things we can do for ourselves and medications that we need to be prescribed. So as I said, mast cells are a type of blood cell that are found in all parts of our bodies, and they are known as the police officers of the immune system, because they are the first responders, if you like, in our immune system, and they detect problematic things that are happening. They release chemicals that are messengers that tell the other immune cells how to respond, and sort of call for backup, if you like, when there's an invasion. And these are the things that our mast cells should respond to. And you'll see there that bacteria is one of those things, along with viruses, parasites, insect stings, and also wounds. So they release a lot of chemicals that help our wounds to heal as well. But you can see for people with MCAS, we then develop reactions to food and our environment as well. So our mast cells start to react to things that wouldn't normally trigger them. So there's a difference here between mast cell activation syndrome and allergies. So allergies are what we call IgE mediated activation of the mast cells. So mast cells ordinarily should be triggered by allergens, which bind to those IgE antibodies and trigger the mast cells to degranulate, which means to burst basically, and release their chemicals, histamine and other different types of chemicals. And it's typically, it happens immediately in an allergy, and it's very predictable. For example, someone who is allergic to peanuts, they only react to peanuts. When they react to peanuts, they react instantly to the peanuts. And if they don't come into contact with peanuts, then all is well. That is an allergy, and it's mediated, it's triggered by antibodies. In mast cell activation syndrome, we call that idiopathic mast cell activation, because in this condition, there is no antibody trigger. And that means that it doesn't show up on normal allergy blood tests, because those tests are looking for the antibodies. But in mast cell activation, we are reacting without the presence of those antibodies. The mast cells are abnormally functioning and releasing their mediator chemicals, and it can be just spontaneous. Our mast cells can become so dysregulated that they just react. And sometimes it's not clear what we're reacting to. And sometimes it is in response to a trigger, but it's things that shouldn't be triggering them, like foods and, cleaning products and toiletries, anything in our environment. I mean, some people react to their own sweat, to their own tears. So our mast cells are reacting completely, abnormally to things that they shouldn't be. And in mast cell activation, the symptoms are chronic and multi-systemic and variable, and there's no one single allergen. So it can be one day you're reacting to one thing, the next day you might be reacting to something else. It's very unpredictable. And sometimes you can be okay with something one day and not okay with it the next, because the mast cells are just reacting completely unpredictably. So that's the difference between allergies and mast cell activation syndrome. So in terms of symptoms and, what you might see and what someone might experience, there's this diagram which comes from our website, and it may be too small for you to read, but I'm going to just sort of mention some of them. So the symptoms affect more than one body system, and in order for it to be MCAS, there must be at least 2 different body systems involved. So if you just suffer with a lot of allergic rhinitis and itchy nose and sneezing and runny nose and absolutely no other symptoms anywhere else, that's probably, an allergy, probably hay fever. If you have a lot of nasal issues and congestion in your nose, and you also have a lot of gut issues, a lot of constipation or diarrhea or tummy spasms, and you're constantly plagued with, lots of tummy problems as well, that is potentially when you would then think about maybe investigation for MCAS. And to be honest, most people have symptoms in multiple body systems, so it's rare even to just have it in 2. So it affects our nose and our eyes, it affects our respiratory system and our lungs, because we have mast cells everywhere in all of these organs. So it can also cause musculoskeletal issues, joint pain and muscle pain. It can affect the genitourinary system, so people get what they think are recurring UTIs, infections, but actually it's the mast cells in the bladder releasing inflammation. Dermatographic symptoms are quite common, so we get a lot of itching and hives and rashes, swelling. It's interesting that we have mast cells in our brain, and they're very closely connected to our nervous system, very closely located near our neurons all over our body. So when they degranulate, if our mast cells are reacting in our head, in our brain, or our nervous system, it can cause neurological symptoms, which can include brain fog and headache and numbness and tingling, but also mood disturbances, behavioral issues, mood swings, anxiety. That can be a symptom. Cardiovascular system can be affected because the mast cells are, lining the heart and the blood vessels. So we can get a lot of chest pain, tachycardia, slow heart rate, bradycardia, and changes in blood pressure, unpredictable blood pressure, sometimes even fainting. And as I said, tummy issues as well. So no 2 people have the same set of symptoms with MCAS. People can have MCAS and they are predominantly affected neurologically and with their gut, and somebody else might have respiratory and skin issues. So the symptoms can be very difficult to pin down, difficult to see in, to be diagnosed, because they present so differently. And also it can change over time. So our mast cells can be predominantly reacting. For example, it's quite common if a child has MCAS, they might have respiratory issues as a child, but then in the adulthood, their MCAS might manifest more in gut issues or urinary problems or cardiovascular issues. So the condition changes as people, age sometimes, or just over time, different mast cells start to react. And it can also progress and get worse. So people might have mild symptoms and then develop more severe symptoms. So this is some statistics taken from a survey conducted by the Mastocytosis Society about people who'd been diagnosed with MCAS, just to give you an idea of the most common symptoms. So you can see here 8 out of 10 of those people had fatigue, chemical and medication intolerances, which is a really key thing for MCAS, food intolerances, brain fog and abdominal pain. 7 out of 10 people get that flushing and redness on their skin, muscle pains and musculoskeletal stiffness and joint pain, hay fevers and reactions to their environment, itching and bloating. 6 out of 10 people, blood pressure changes, nasal and sinus issues, that lightheaded fainting picture and diarrhea. So that's just a snapshot really of some of the more common symptoms that people tend to have. So anaphylaxis is, I mean, we know about that for people who have things like peanut allergies and other type of true IgE-mediated allergies. They can experience anaphylaxis, which can be life-threatening. And some people mistakenly think that with idiopathic mast cell activation syndrome, you can't get anaphylaxis, but actually some people with MCAS do. So there's 2 types really. There's non-anaphylactic MCAS, where people generally don't tend to experience anaphylaxis as part of their reactions, and people with MCAS who do have anaphylaxis. And it's very serious and it can be very severe, potentially fatal. People struggle with coming into contact with food and drink, going into environments where there are lots of chemicals. We have people in our community, for example, who go into anaphylaxis immediately upon entering a hospital. So it makes it very difficult for them to access proper medical help, because if they ever need medical treatment, as soon as they go into the hospital and breathe in the air in the hospital that has obviously been cleaned and bleached, and, you know, maybe drugs in the air that have been, you know, used in that environment, people's perfumes that they're wearing in the waiting rooms, they immediately go into anaphylaxis and their airways begin to swell and they find it difficult to swallow, very difficult to breathe. Circulation and consciousness, people's blood pressure tends to drop very suddenly and people can pass out and collapse. And there's often a lot of abdominal cramping, violent, you know, diarrhea or loss of bladder control as well. And that is potentially life-threatening and needs treatment for anaphylaxis. So they need to carry EpiPens, and quite a lot of specialists who work with people with MCAS who have, you know, patients who are anaphylactic, they will prescribe EpiPens, and, you know, they must carry their EpiPen with them because they may have an anaphylaxis. So we talk about mast cell mediators. So the mast cells have within them lots and lots of chemicals, which are mast cell mediators. And when they come into contact with one of these triggers, the mast cells do something called degranulate. So they burst and they release these chemicals, the mediators, from the granules where they're stored. They burst and are released in large amounts into the bloodstream. And there are potentially hundreds of different mediators, and we don't know yet. Science hasn't identified all of the different chemicals that mast cells release, and we don't know what all of them do yet, and we certainly can't measure all of them. So the 2 that are most commonly known about are histamine and tryptase, but there are prostaglandins and heparin and all sorts of other chemicals that are released. But histamine is the one that tends to be talked about a lot with MCAS, and sometimes we need to remind ourselves that it isn't just histamine, because those other chemicals are also acting in the body and having effects on people. And people with MCAS may not have elevated levels of histamine, but a lot of people with MCAS do struggle, particularly with histamine. And as I said, it was one of the first kind of indicators for me that I had MCAS, because I realized that I had a problem with histamine. So There's some studies here, Molderings and Afrin, who are two of the top kind of leading doctors in the world who study MCAS. They've identified so far 390 potential mediators that are released from mast cells. But as I said, that's not the final figure because we don't really know. And it's interesting to realize that some of the mediators are kind of pre-made. They're stored in the mast cells, just ready to go. And histamine is one of those. And they're released instantly when we come into contact with a trigger. But others are released at later times. So leukotrienes within 15 minutes, some of the inflammatory cytokines that are released by mast cells aren't released until many hours later. Sometimes the mast cell starts making them when it comes into contact with the trigger, but then they're released later. So this is important to understand that reactions can be delayed, sometimes by many hours, even up to 24 hours. So when you're starting to think about what am I reacting to, it's not like an allergy or an anaphylaxis where you eat the peanut and instantly you know you're having a problem. You can eat things, you can come into contact with things, you can think everything's fine, and then you become very poorly that night or later that day or even the next day. So looking for these patterns then becomes much more complicated and much more tricky to work out what you're reacting to. So we talk about the histamine bucket theory to try and explain what happens to people with MCAS, particularly those of us who are affected by histamine, but it applies to all of our different inflammatory chemicals really that are being released by mast cells. So you can think of it like a bucket. Our body is like a bucket, and whatever we come into contact with, we're eating things, we're breathing things in, we're coming into contact with the environment, it fills our bucket gradually. And if somebody can empty the bucket of histamine, then they tend to be quite well and they tend to have fewer symptoms. If their bucket gets very full, it overflows, and that's when people start to feel very poorly. So it enables us to get some control over the condition because we can work on keeping our bucket empty. And this also explains why you can react to, or you can be okay with something one day and eat a food and it be fine, and the next day you eat the same food and you might react because one day your bucket might be very empty. You've not come into contact with anything else. Your mast cells haven't degranulated and you haven't, got any or very little histamine in your system. So you can eat that food and it doesn't really matter. And the next day you might have been out, you might have been exposed to perfumes, you might have eaten lots of foods that maybe, high in histamine, and your bucket is really full, and then you eat that food again and it overflows, and that's when we get symptoms. And that can be the picture for a lot of people with MCAS. And again, it makes it tricky to manage and tricky to understand sometimes. So these are just some amazing pictures of mast cells. So there's the resting mast cell that's perfectly happy and calm. And then you can see that middle picture there. It has been activated. And that's what we mean by degranulating. It's burst and it's released all of its inflammatory chemicals into the body. And you can see there, it's those little granules is why we call it degranulating, because the chemicals are stored in granules on the surface and you can see them being released there. So as I said, with mast cell activation syndrome, what happens is those mast cells begin to degranulate inappropriately and release their chemicals in response to a wide range of normal, everyday things that they shouldn't be reacting to. So some of the things that cause our mast cells to degranulate, they still react to the normal things that they should react to, like parasites and viral infections and bacterial infections and insect bites and wounds, and they react to things like pollen in the same way that people with allergies do. But stress triggers mast cells to degranulate. There's really good research now that shows that when we are under stress, as I said, the neurons and the mast cells are very close to one another. They communicate with one another. So when the nervous system is stressed and releasing stress chemicals, the mast cells respond to that. So stress is a big trigger for a lot of people. Medications, it's, a really unfair situation that people with MCAS can actually react to antihistamines and drugs, and particularly particularly the excipients, the fillers, the colorings, the things that are in the drugs, but also sometimes the drug itself our mast cells react to. Caffeine is a big trigger. People react to temperature changes. So our mast cells can actually respond. Some people it's cold, some people it's heat, some people it's the change in temperature. If they go from a hot environment to a cold environment, they will suddenly flare up with a massive allergic response. Foods are a big issue for people with MCAS, and I'll explain a little bit more later. All food contains histamine, and the act of digesting food releases histamine. So if we've already got a really full histamine bucket, eating becomes very problematic, and we need to think about eating foods that are lower in histamine, because some foods are very high in histamine and some don't have as much. So we can control our levels of histamine a little bit by choosing what we eat. Fragrance is a really big problem for people with MCAS. A lot of people struggle with reacting to fragrances and chemicals. You can see there. So anything like plastics and furniture that give off volatile organic compounds, flame retardants, things that are in our environment, new building materials, they're all off-gassing chemicals, and people with MCAS can really struggle with that. They also can react to the chemicals in toiletries and in cleaning products. Alcohol is a big trigger. It triggers our mast cells. A lot of people have trouble with alcohol for that reason. People with MCAS obviously don't need that additional burden in their system. And interestingly, our hormones, particularly for us ladies, our hormonal cycle is very closely tied with our MCAS reaction sometimes, because our estrogen and histamine are linked. So when estrogen goes up, histamine also goes up, and vice versa. So you can imagine during certain times of your cycle when the estrogen levels are high, your histamine levels will be high. And if you're already struggling with a lot of other reactions, you might find that your MCAS symptoms become much worse at those times of the cycle. So MCAS is associated with a lot of other conditions, and people often talk about the trifecta. So there's MCAS, there's hypermobility spectrum, and there's dysautonomia conditions like postural orthostatic tachycardia or POTS. And those three tend to be very connected, and people with MCAS quite often have elements of one or both of the others, but in different variations. So some people are very hypermobile, some people are very mildly hypermobile, some people have POTS really badly, other people have, maybe a little bit of dysautonomia going on. So those three, it used to be, just those three that people talked about. But as I said, there's a lot of people doing research now that is showing lots of different conditions tend to be comorbid with MCAS, and we still don't really know what that relationship is and why those conditions tend to happen together, and whether it's to do with the MCAS, whether the MCAS is driving the conditions or whether those other conditions are driving the MCAS. Nobody really knows yet, and there's more research that needs to be done. But quite often people have diagnoses of fibromyalgia, they have diagnoses of ME/CFS, people have often have neurodiversity. We see a lot of people with MCAS are neurodiverse, and again, the connection is not very clear yet. PANDAS, these inflammatory encephalitis caused by bacterial infections, either strep infections or other infections. There's a lot of overlap there with MCAS. People often have PTSD. People are off or have been diagnosed with PTSD. People are often diagnosed with irritable bowel syndrome. We see people with MCAS who also have other or have autoimmune conditions as well: Crohn's disease, celiac disease, rheumatoid arthritis, lupus. There's a lot of overlap. Interstitial cystitis and recurring UTIs and bladder pain is another really common thing. Kunis syndrome is a syndrome that happens when people respond to allergic reactions by their muscles around their heart going into spasm, and that can cause problems with the heart, and people with MCAS do experience that as well. You can see there at the bottom, long COVID, we're seeing a lot of overlap with people with MCAS, developing MCAS after experiencing COVID. And there's some discussion about whether some people's long COVID might actually be MCAS. People with multiple chemical sensitivity, huge numbers of people with MCAS have chemical sensitivity. As I've said, ME, CFS, and Lyme disease, you'll see there is on that list as well. Many people have more than one condition. Many people with MCAS are misdiagnosed with one or more of these conditions. And actually, it turns out that most of their problems are down to MCAS sometimes. So this is why it's really important to be aware of MCAS, because it might be that you don't have fibromyalgia or ME or whatever, IBS. It might be that if you were on the correct medications and managing MCAS correctly, you might be, able to recover quite significantly. So it's important to look at these comorbid conditions and see this complex picture that's going on. And it's different for each person, obviously. Some people they just have MCAS. Some people have complex multi-system symptoms. So you see there on that list, it's recognized in some circles that MCAS and Lyme disease, there is a connection there. So I've taken this piece of text from Dr. Tanya Dempsey's website, and some of you may know of her. She's a doctor in the United States who works with people with Lyme disease, but also specializes in MCAS. And she writes, there's a significant subset of patients with chronic Lyme symptoms who develop a condition known as mast cell activation syndrome. The symptoms of MCAS overlap with the symptoms of chronic Lyme. There are patients who will just have MCAS alone without Lyme, but there will be others who have had Lyme as a trigger for their MCAS, and these patients need to be treated for both. So she says here, mast cells contain over 200 different chemicals, and that, now we know there's over 300, but when she wrote this, 200, and including histamine. And when they're attempting to fight off something foreign, in this case, Lyme disease, they degranulate, releasing those chemicals, causing inflammation. And for those patients, if they have MCAS and Lyme, the Lyme needs to be treated as well as the MCAS, is the point that she's making there. So there was a study published in 1999, which is entitled Borrelia burgdorferi spirochetes induced mast cell activation and cytokine release by Jeffrey Talkington and Stephen Nicol. And so you can see there, the title says it all really, that in that study, they demonstrated that when mast cells were exposed to Borrelia spirochetes, it induced them to release their chemicals, their inflammatory chemicals there, and degranulate. And this was done in mouse and rats mast cells, but they demonstrated that Lyme disease bacteria does cause mast cells to degranulate. So we can see there's some evidence there that having Lyme disease could cause mast cell activation syndrome in your mast cells. And again, there's a couple of other doctors working with Lyme patients in the United States. I'm sure, many of you will be familiar with Dr. Bill Rawls. Signs and symptoms associated with mast cell overactivity are not uncommon in people struggling with chronic Lyme disease. Microbes and other stress factors associated with these conditions disrupt immune system functions and push certain aspects of the immune system, like mast cells, into overdrive. So that's what they're seeing in their patients with Lyme, that their mast cells, for some people, their mast cells are being pushed into becoming oversensitive and overactive, and they're developing mast cell activation syndrome. And Dr. Todd Mader is the same. About half of the patients he sees with tick-borne infections also experience MCAS. So we can start to see that there is a connection there, potentially for some people, between having Lyme disease and it triggering our immune system to go a little bit wrong. And as I mentioned, it's worth noting that there's also increasing research that there's a connection between long COVID and MCAS. So there's considerable overlap with the symptoms of long COVID and the symptoms of MCAS. Medicines that reduce mast cell activity and lower histamine levels. A lot of people with long COVID, when they get on antihistamines and mast cell stabilizers, their symptoms improve. We know that mast cells are activated by the SARS-CoV-2 virus. So we know, similarly to the Lyme bacteria, mast cells are also activated by the COVID vaccine. And mast cells obviously are involved very heavily in driving inflammation, which is a big factor for people living with long COVID. So there's a proposal now that if people with long COVID have allergic or inflammatory symptoms in their, gastrointestinal system, in their respiratory system, in their skin, they should be considered for an MCAS diagnosis in some circles. So I was asked recently, how can you know if you're experiencing MCAS or Lyme disease? Because the symptoms overlap so much, and because there's a lot of similarity between them, and if you've got both or you think you might have both, how do you tell the difference? And I think a lot of the symptoms that we experience with Lyme disease are caused by the immune system's response to the Lyme disease. So the inflammation that's being released by our immune system and the kind of dysregulation of the immune system that Lyme can cause. And so when our immune system, when our mast cells begin to try and attack the Lyme, they're, releasing all of these chemicals because they can see this bacteria there. And that is what we're experiencing. So when we experience all of these systemic symptoms in different parts of our bodies, it can be possibly sometimes because it's our mast cells that are reacting. And it's important to understand that addressing the inflammation that goes with MCAS and working with MCAS to stabilize your mast cells and maybe reduce your histamine levels may well improve your symptoms and help you to feel a little bit better, like it did me. But it isn't a cure. You also have to be killing the Lyme disease as well. But it's worth exploring whether histamine and mast cell activation and inflammation caused by mast cells might be a factor for you in your Lyme symptoms, because if you can address that, it might make you a bit more comfortable on a day-to-day basis. And you can see here, I've just pulled out some of the symptoms of high histamine levels: fatigue, brain fog, migraines, neuropathy, nerve pain, numbness and tingling, heart palpitations and tachycardia, insomnia, joint and muscle pain, muscle twitching, muscle cramps, visual disturbance and blurring, tinnitus, ringing in the ears, and sensory overload and sensory sensitivity, sensitivity to chemicals and to drugs, upset tummy, constipation, just bowel disturbance, stomach pains, mood swings and agitation, anxiety and depression, and even suicidal thoughts. We see if people's mast cells are degranulating in their brain, they quite often report symptoms of feeling unexplained suicidal thoughts. Now, I'm sure that many of you are looking at those symptoms and thinking those are the symptoms of Lyme disease. And certainly, I mean, that is the list of symptoms that I was experiencing. That is my list of symptoms. And when I took antihistamines and got on mast cell stabilizers, it helped me with all of those symptoms. So you can see there the overlap between the symptoms of histamine and what we traditionally consider to be Lyme disease symptoms, and how some of them may actually be being caused by our mast cells. And it's worth noting that histamine, we think of it as an allergy thing. We associated it with pollen. When I started researching this, I thought, I can't possibly help me with all of these things. It's hay fever. Histamine causes a runny nose. I don't understand how antihistamines are possibly going to help me with all of these awful symptoms. And they did. And then when I started to research it and understood that histamine is actually a neurotransmitter, it's very active in our nervous system, and it is neurotoxic at very high levels because it is excitatory. It stimulates the nervous system. It causes wiring and overactivation of the nervous system. And that's why we get things like insomnia and twitching and buzzing and numbness and tingling, because the nervous system is being very overactivated, and sensory sensitivity as well. by, the histamine upsetting our nervous system, really. So, as I said, reducing histamine is not the cure for Lyme disease, but it can really improve symptoms if your symptoms are being caused by histamine. It's worth exploring because it can help to make you more comfortable. So, how do we do that? How do we manage MCAS and reduce our histamine levels and improve that? So there are two sort of ways, really. Self-management, a lot of it is things that we need to do ourselves within our daily lives. So I've talked about food, exposure to fragrances and chemicals, managing our stress levels, managing our environment so that we're controlling the temperature as much as we can, and exercise. A lot of people with MCAS respond badly to exercise and they actually experience allergic reactions to exercise. So we can, some of that was within our control, and we can do that for ourselves on a daily basis by identifying what our triggers are and reducing our exposure to it. And then the secondary aspect is if we can find a doctor who will work with us for MCAS, they can prescribe medications like antihistamines and mast cell stabilizers that can also help. So one of the first things to do is to keep a diary and record all of the things that you not only eat, but your environment as well, what you come into contact with, where you go, what temperature, you're exposed to, whether it was very cold, very hot, whether you are in certain rooms of your house or in other people's rooms, whether you were with a friend with perfume on, whether you used certain cleaning products, what toiletries you used, keeping a really detailed diary for, a few weeks maybe, and also monitoring your symptoms. And you might begin to see a pattern, bearing in mind that delayed reaction time. So you may need to look a day ahead to see every time you eat something, for example, tomatoes, maybe 2 days later you have a very poorly tummy and you see that pattern happening again and again. You will then identify that tomatoes are an issue for you, or it might be that you eat them and you're very poorly immediately. So you need to start, this is why you need to keep it for a period of time so that you can then begin to see these patterns happening. And we do have a free download on the Mast Cell Action website of a symptom log that can help you with this and help you to identify whether you're getting skin symptoms or respiratory breathing problems or urinary symptoms. So feel free to go to our website and download that. So I talked a bit about diet and the fact that foods have histamine in and they can be a big factor for those of us with MCAS. So there is something known as the low histamine diet. It's quite debated by various different dietitians and nutritionists because the levels of histamine in certain foods it's difficult to measure, but there are lists online of foods that are very high in histamine and foods that are generally low in histamine. It's important to work with a dietitian or a nutritional therapist who is aware of MCAS because obviously cutting out foods is problematic and we need our nutrients, especially when we've got Lyme. We need to make sure that we're keeping our nutrient levels up and we don't want to be removing foods unnecessarily. So it's important to do it as a trial, to do it for short periods of time and to then attempt to reintroduce foods so that you only exclude the foods that you absolutely definitely are reacting to and that are problematic to you. We have resources about this on our website. We have a self-management toolkit, which is free to download. And I'm also currently working with a dietitian on a new resource called Nourishing Health and Happiness with MCAS, and that will be coming soon. It's just being artworked at the moment. So that will be a much more detailed dietary information coming then. And it's important to recognize that we're all different. And even people with MCAS, bananas are always on the high histamine list. I've always been able to eat bananas, but other foods I react really badly to. So it is a very individualized thing. You can't say there's one size fits all for MCAS, but most people or many people find that by identifying their particular triggers, avoiding the foods that are very high in histamine and eating the foods that are, safe for them, they can manage their MCAS quite well using diet for some people. And, many people do a low FODMAP diet or low sugar ketogenic diets, as they do in the Lyme community. And the reason for that is because they all lower inflammation levels. So they can all be helpful diets for people, but it's useful to get some specialist support with this. And some people find, it's salicylates that they're reacting to, which is a chemical that's in some vegetables, oxalates similarly in vegetables, lectins in lentils and peas and things. They can be a problem. So people with MCAS, it may not be histamine that's your problem. It might be that it's salicylates or lectins that you're reacting to. For some people, gluten is very problematic, or dairy. Other people not so much. It just depends on what your mast cells are taking objection to, really. So it's a case of trial and error and seeing if changing your diet makes any difference. So these are some of the prime suspects. As I said, it's very individualized. It's different for everybody. But generally speaking, these foods tend to be very high in histamine. So tomatoes, avocados, strawberries, alcohol we've mentioned, cured meats and cheeses. So anything that is old, so food, the levels of histamine in food go up the older the food is. So a general rule of thumb is the fresher you can get your food, the better it will be and the lower the histamine. So people struggle with fish and seafood because it goes off so quickly. By the time it gets to the supermarket, it's old and it's high in histamine. But there are companies online that sell fish that's been frozen at sea, so it's as fresh as it can possibly be. And some people with MCAS tolerate that fish because it's low in histamine. I go to my local butchers and I get their meat the day after, it's delivered to them, so it's as fresh as it possibly can be. I don't buy my meat from the supermarket because, I can't tell how old that meat is. And anything that's cured, like ham and salami, they're going to be old and aged steaks, cheeses, young cheeses like mozzarella. Some people with MCAS can tolerate those, but very old, aged, stinky cheeses, blue cheeses, they're really high in histamine, so they're going to be a problem if you're struggling with histamine. Some nuts, gluten, as I said there, coffee and chocolate, unfortunately. Bananas, as I said, citrus fruits, they're not high in histamine themselves, but they release histamine in the body. So when we eat or drink oranges and lemons, it's a histamine trigger. It releases the mast cells causes the mast cells to release histamine. So some people struggle with citrus as well, and pineapple there. Leftover food. So you might be absolutely fine to eat a meal that's freshly cooked, but if you put the leftovers in the fridge and then try and eat that same meal the next day, you may well react to that. And it's because the histamine levels have gone up because the food is not fresh. Yeast, soy, tomatoes, again, aged meat, and vinegar, very high in histamine. So if you're looking to improve your inflammation levels and lower your histamine levels to see whether it makes any difference to your symptoms, avoiding foods like this can potentially help. But as I've said, it's not just foods, it's your environment as well. So people with MCAS also have to think about the cleaning products that they're using unfragranced, natural cleaning products. I mean, I just use bicarbonate of soda and vinegar. But you can buy natural, low chemical, unfragranced cleaning products online. And the same with toiletries. You want the really natural, usually the eco-friendly products tend to be quite good for us with MCAS as well. The fewer ingredients, the fewer petrochemical derived ingredients in them, the more likely it is to be well tolerated by people with MCAS. But again, it's completely individual. Some people may be fine with things and other people may not. Essential oils are a tricky one because obviously the natural stuff tends to be flavored and fragranced with essential oils, and they they can be a trigger for people with MCAS as well. So it's not necessarily safe. So you really, unfragranced is best. Pollen, again, mold is a big one, making sure you're not exposed to mold, because it really does affect the way our mast cells work. And if you've got MCAS, it will really dysregulate the mast cells. A lot of people struggle. So making sure you haven't got any mold in your environment. Pesticides and herbicides on agrochemicals on foods. A lot of people with MCAS are really sensitive to those, so they have to eat organic because they struggle to process them. Again, drugs and the excipients and the fillers and things that are in medications, a lot of people with MCAS can struggle. As I said, hormone levels, bites, stings, our emotions and stress, changes in temperature and changes in atmospheric pressure. So these are all the things that we also need to think about in managing our environment. And we need to create a little kind of safe bubble for ourselves when we live with MCAS. And many people can get into a state of remission or at least stable and have a much improved quality of life if they create a safe environment for themselves at home and they remove as many of their triggers as possible. And if you're looking at this and thinking, it's overwhelming, I can't possibly, remove everything. Remember, the first step is that diary. It may be that you don't need to remove everything, but you need to work out what your triggers are first and then remove them. Then once you're in that safe environment, many people's symptoms stabilize, and then they have much more room in their bucket, which then enables them to maybe go out sometimes or, have a meal out somewhere. If your bucket is full all the time because you're living in an environment that's full of your triggers, it's going to be very difficult to get stable. So there, I've just explained a lot of things about that. So using natural non-toxic ingredients and for toiletries and for cleaning products, unfragranced. Air purifiers are a real godsend. I've got a little one next to me on my desk. I have one in every room, especially in your bedroom, really good quality air purifier with HEPA filters that are purifying not just dust and pet hair and pollen, but that are getting rid of VOCs. And there are some that will remove, VOCs, formaldehyde, things like that from the environment and chemicals from the environment. So you want a really good quality air purifier, especially in your bedroom, so you're breathing in good quality air. Water filters, again, many people with MCAS react to tap water because it is full of, all sorts of things that really aren't, necessarily meant to be there, but we can filter them out. And just the more you can remove from your environment, the lower your bucket is going to get. So, the better you're going to feel. So air purifiers and water purifiers, you're just getting rid of anything in your environment that doesn't need to be there. Plastics can be a problem. I've tripped myself up many times by buying new furniture and new products. I get all excited in the shop and I bring it home, and then I realize that it's giving off, new things smell. That smell is chemicals, and my mast cells do not like that at all. And I very often buy things and then have to relegate them to the garage until they've finished off gassing. So it's important to think about things that might be in our environment, mattresses, new furniture, new washing machines, things like that. They're all giving off chemicals. So how do we get diagnosed with MCAS? So there's a 4-step criteria that mast cell specialists use. The first step is that you have to have symptoms in 2 or more body systems that we talked about. The second is that when you try taking mast cell stabilizers and antihistamines, your symptoms improve. That's a bit of a double-edged sword because, as I said, you can react to those drugs. So it's not necessarily that you're going to improve. It might make you worse. But generally speaking, with trial and error, you might find some medication that helps. There are some tests for the mast cell mediators. There is no test for MCAS, but science can test some of those mediators. And if they're very high, some doctors will see that as an indication of MCAS. And obviously, other diagnoses need to be excluded. So, it may be that you've got another condition instead that needs to be considered, particularly mastocytosis, which is where we have too many mast cells, and it can, be possibly connected to like cancer, type of cancer. So our mast cells are overgrowing. So with people with MCAS, we have normal numbers of mast cells. They're just overactive. But people with mastocytosis, they have too many mast cells. Similar symptoms, because the end result is they end up with too many levels of histamine and too many mediators, the same as us, but the cause is slightly different. And it's important to rule out mastocytosis because, as I say, there may be a cancerous element there. So different tests that doctors may do. A lot of people talk about the tryptase blood test. That's useful for mastocytosis, but it's not a marker for MCAS. It's normal generally in people with MCAS. IgE allergy tests, again, they're normal in us because it's not mediated by antibodies. There are these urine tests, a 24-hour methylhistamine test, urinary and methylhistamine and prostaglandins. Some labs, there's 2 labs, I think, in the UK, Sheffield, and the doctor's laboratory in London, do test for urine levels of histamine and prostaglandins. Sometimes they're elevated in people with MCAS, but the tests are quite unreliable. These mediators are very volatile. They degrade very quickly, so it's quite hard to catch them in a test. So even if the tests come back negative, it's not enough to rule out MCAS. Biopsies can be helpful. So some people who do colonoscopies, they will take a biopsy and stain it for a CD 117, and that can show mast cells, and that can lead to a diagnosis of MCAS. And there's research happening to see whether there are genetic tests, whether it's a genetic condition, whether it can be picked up genetically. It's not available yet. We don't have a genetic test, but there is research happening. So I'm not going to go into great detail here, but the urine test has to be done in a very specific way. You have to keep it cold. It has to be, refrigerated and frozen. It has to be processed in a very specific way. So it's quite tricky to get the test done. And as I said, Sheffield is really, the main laboratory for doing it. And most doctors are not aware of this. They're not using this test. It's not available on the NHS at the moment. So it's only private specialists who are doing this urine testing. And we do have a leaflet, again, downloadable free from our website at mastcellaction.org, where, there's testing leaflets there that explain more about the testing if you're interested. So just really this slide is to show that how variable it is. So this is one family. The daughter was diagnosed at 7, the son at 10, and the mum has it as well. And she was diagnosed when she was 36. But they all have very different symptoms. So the daughter, diarrhea and itching, the son, constipation, fainting, other symptoms, joint pain, and the mum, she gets flushing and nasal issues and headaches and anaphylaxis. And again, you can see they're different treatments that they're on. So there are drugs that are used by some specialists who work with MCAS. So there are H1 blockers, so antihistamines that you buy over the counter from, Boots or whatever, cetirizine, loratadine. They're H1 blockers. They block the H1 receptors in the body, so that it blocks the histamine, basically. There are H2 blockers, so they're only available on prescription, but nizitidine, cimetidine, famotidine, they're H2 blockers, and some people find that they help them more than H1 blockers. Many people with MCAS take both. Then there's sodium chromoglycate, and that's a mast cell stabilizing drug, and ketotifen is another mast cell stabilizing drug. They're only available on prescription from specialist mast cell, doctors, immunologists, and allergists. Some places in the NHS fund them and some places don't. So it's difficult to get them funded on the NHS sometimes. Many people are having to get private prescriptions for those. Low dose naltrexone, very helpful for MCAS because for some people, because it reduces the inflammation, but for other people, not so helpful. And I can never say this, omalizumab. It's another treatment that is being trialed for a lot of people who have quite severe MCAS. They may get prescription for that, but again, it is quite restricted on the NHS who will be able to have that. So if you think you might have MCAS, you can think about whether reducing your exposure to histamine might help, reducing eating high histamine foods, just trialing that to see. Again, not long term without support, but you might do it for a week and see if your symptoms improve. Keep that diary and identify any potential triggers. I will say it's quite tricky for us because with Lyme disease, our triggers are inside us. So if you have, made your environment absolutely pristine and you're not eating or coming into contact with anything else, but you're still reacting, then, it's an internal trigger, potentially, Lyme bacteria, something like that. So it can be tricky to spot when we live with Lyme, to spot those ups and downs. But if our histamine levels drop and once we get it under control, then we can maybe see those patterns a little bit better. You can explore removing chemicals, man-made chemicals, petrochemicals from your environment, cleaning up your toiletries and your cleaning products, and remembering that it's not just histamine though. So if you do all of this and it doesn't help, it may be just that histamine is not your primary mediator that's being released. You might have more of a problem with leukotrienes or prostaglandins, so it doesn't necessarily rule out MCAS if reducing histamine doesn't help you. So, symptom tracker, you can contact your GP and discuss your symptoms. It's tricky to get a diagnosis of MCAS. I won't lie to you. There's a lot of, there's not much knowledge or understanding of it yet in the NHS everywhere. So it's a bit of a postcode lottery. Some GPs understand it and some don't yet. Some the same with immunologists and allergists. It can be tricky, as I said, and quite a lot of the time people have to go private to get a diagnosis of MCAS, which may or may not be recognised by their GP. However, it's not necessary to get a diagnosis in order to get some help with the symptoms, because if you can explain to your GP that you're getting allergy symptoms, that you're reacting to foods, that you're getting rashes, you're getting stomach problems, and you want to try H1 blockers, H2 blockers, sodium chromoglycate, ketoprofen, it's possible to, get prescriptions for medications for symptoms. You can get referred to, dermatology, for example, if your symptoms are skin-based, and they can give you the drugs. They probably won't recognize that it's MCAS, and they won't say that it's MCAS, but they will give you the medications that might help you feel better. So don't get too hung up on getting a diagnosis necessarily, because that can be a really big barrier for people if in their area the NHS is not recognizing. So if you email info@mastcellaction.org, that's excuse me, one of my lovely colleagues is mans our inbox there. So info@mastcellaction.org, and she has a list of MCAS aware doctors that you can ask for, and she'll send you that list. We also have a lot of resources for GPs and medical professionals on our website. So you can download, there's a primary care guide, so you can print off the primary care guide and take that to your GP. And there's the leaflet about testing. You can print that off and take that to your GP. So there's some information there that may be useful to you and to your GP. And there's a bit about MCAS as well in the RCGP toolkit on Ehlers-Danlos syndrome. They do mention MCAS. So it's another source of information that might help you with getting a diagnosis. So finally, just a little bit about us at Mast Cell Action. The charity was formed in 2015 by 3 people who were affected by MCAS, and they realized that there was no support out there. And at that point, nobody was recognizing MCAS, and there weren't any doctors really who were working with it, or very few. And it was really, really tough to get any kind of help. And so they formed the charity to offer support to people living with mast cell disease, their family, the doctors and the researchers who are all working towards better understanding of MCAS. and we're the only UK charity that's dedicated to supporting people affected by MCAS. And nearly everyone who works and volunteers in the charity is affected by MCAS, either living with it themselves or through a family member or a friend. I just want to mention our amazing CEO, Joy Mason, because, you know, much of what's in this presentation today is down to her and the research that she's done. And she has, you know, she's worked in the charity sector for a long while. She's absolutely passionate about MCAS. She lives with MCAS. Her 2 children have MCAS. She lives, breathes, and works MCAS and Mast Cell Action. She works so hard for the charity to help to drive knowledge of MCAS forward. She's particularly very active with the healthcare professionals and does a huge amount of advocacy and education for medical professionals and attending conferences and things. So she's absolutely the driving force behind Mast Cell Action. And we have a Facebook support group that you can join, and you'll find there's a lot of people on there with Lyme disease. We have, we're on the social media platforms on Facebook and Instagram, and we have an amazing YouTube channel with lots of really helpful videos, interviews and webinars with doctors, and lots of great content on our YouTube channel. We do a lot of virtual sessions. We have online Pilates and online Qigong. And we do every Thursday night an online like community support, peer support group where people with MCAS just come and chat and support each other. We have lots of resources on our website. That's kind of what the area that I oversee. So loads of free resources to download on our website about MCAS, about the symptoms, about triggers. We run MCAS Young Voices. So there's a group of young people with MCAS who we work with to create resources for young people. You can sign up to our newsletter and get information and be involved in piloting things and contributing to our research and our studies. We have an amazing storybook called Casper, which is for young children, and it's beautiful, and there's a resource pack, and you can get that for free. There's a link on the website, or again, if you email info@mastcellaction.org, they'll post you a Casper storybook out, and it's really beautiful for children who are living with MCAS. And we also have a peer support service and a parent support service, so you can be paired with a one-to-one mentor for, I think it's 6 or 8 sessions, and have one-to-one support with some of our amazing peer supporters who are really brilliant volunteers who volunteer our time. We're very small. There's 4 of us who are staff, and the whole of it is run by volunteers really who do an incredible job and are just amazing. All of these resources is just a selection of some of our resources. You can see the Casper pictures there, and they're all free to download from our website. This month, June, is International Mast Cell Disease Awareness Month, which is why I asked if I could do this talk this month, and Julia and the team very kindly squeezed me in. So we've got lots of events going on this month and lots of awareness raising. So follow us on Facebook and YouTube and Instagram, and you'll see lots of posts about Awareness Month. And this is all the contact details. So our website is mastcellaction.org. info@mastcellaction.org is our generic inbox where Denise will answer your emails, another one of our amazing volunteers. You can email me directly, Deborah@mastcellaction.org as well. And I think that is the end, and I've overrun, so I don't think there'll be time for questions, but you're very welcome to email me.
Coming back. Oh, well, Deborah, that was an amazing presentation. So much information and, well, just amazing. And I've learned stuff that I'd never even dreamed of learning before about my own situation. So thank you for giving up your time for the Lyme community. We won't have time for questions, but as you've made clear, anybody who has any questions can contact you or your colleagues. As I wrote in the chat box at the beginning of the session, this session was recorded, and everybody who signed up for it will get a recording, so nobody has to miss anything. They can play it back at their own speed. And well, just thank you. You know, that is a huge amount of information, and I think probably has implications for quite a lot of people who are listening. So I'm going to close the session now, but from all the team at Lyme Disease UK, thanks so much. And it's been a real pleasure to meet you. We've been trying to meet for a long time, haven't we? So now we've
Yeah,
virtually. So next time, that coffee, eh?
yeah, absolutely. Thank you so much. It's been a pleasure. Thank you for having me.
And thank you to everybody attending. We had a good amount of attendees, and other people who registered will get this information as well. So that's just brilliant. So thanks to everybody in the background. And thanks again, Deborah. Just amazing. I'm blown away by that information. Thanks ever so
Thank
much.
you. Bye, everyone.
Bye.